Hello, everyone. I'm Leslie Wenstall, the Education and Awareness Coordinator at Dysautonomia Support Network. And today we're pleased to have Dr. Melissa Geraghty, a doctor of psychology, present on medical gaslighting in the chronic illness community. Dr. Geraghty is a licensed clinical health psychologist, CEO of Phoenix Rising with Dr. G, an empowered relief instructor, and a medical gaslighting sensitivity trainer. She's received recognition for her clinical experience and patient advocacy as a keynote and international speaker. Dr. Geraghty has well over a decade of experience fostering the mental health, self management, and perseverance of patients and their families. She specializes in chronic pain, complex medical, and eating disorders. She's a dysautonomia, chronic pain, and rare disease patient who inspires others with her resilience and grit. So, Dr. Geraghty, thank you for being with us today.
Hello, everyone. I'm Dr. Melissa Geraghty, and I'm pleased to be able to present to you today on medical gaslighting in the chronic illness community. And a big thanks for the Dysautonomia Support Network for having me today so I can share this knowledge with you. So, to start, I'd like to tell you a little bit about myself. I'm a licensed clinical health psychologist. I specialize in chronic pain, complex medical, and eating disorders. I'm CEO of Phoenix Rising with Dr. G, a keynote and international speaker. I'm also a medical gaslighting sensitivity trainer, and I'm a complex medical patient. I now have over 50 medical diagnoses, including dysautonomia. So let's dig right in. What is medical gaslighting, you ask? So, gaslighting is when a person intentionally manipulates another person to the point where they question their own beliefs, reality, judgment, and memories. And it's absolutely a form of emotional abuse. There's lots of techniques of gaslighting, such as countering. People might say, you never remember things accurately, or you have a bad memory. Withholding, I don't know what you're talking about. I didn't say that. Trivializing, you're overreacting. Denial, also I never said that. Blocking, diverting, why are you so defensive? And so here's some medical gaslighting examples that you or a loved one or friend may have experienced. Maybe you were told that your increasing concerning symptoms are just anxiety, or those symptoms are just a panic attack. All your labs came back fine, so you're fine. We don't need to do additional tests. I'm sure your other doctor didn't mean to say that. Maybe you misheard them. You're over exaggerating. No one can have that many symptoms and still talk or smile. You just need to exercise more or lose weight. This is a very common one that a lot of people hear, that everything is blamed on weight or diet. This procedure typically isn't painful, so you shouldn't have had that response. I barely did anything. It's all in your head. Here's a referral to see a psychiatrist or a therapist. What did you do? Google your symptoms? I went to medical school and know more than the internet. And another favorite of mine, I have never had a patient with that diagnosis, so you don't have that. So with medical gaslighting can come trauma. And medical trauma is defined as a set of psychological and physiological responses to pain, injury, serious illness, and medical procedures, and also frightening treatment experiences. And here's some information that's worth checking out at this website to see the fact sheet for survivors. It also discusses medical trauma in relation to PTSD, so very important information here. So here's some signs that you personally have been gaslit. Maybe you feel that you must plan extensively for medical appointments or meetings. Maybe you don't feel comfortable or safe enough going to a medical appointment alone. Before a medical appointment, maybe you mentally go through all of the worst things that the doctor, nurse, or staff member may say or do, and you think a lot about how you should respond. Maybe you shut down in medical appointments or afterwards. You become emotionally numb or mentally exhausted after medical appointments as well. Maybe you question yourself and the validity of your pain or your symptoms or your thoughts. Maybe you wonder if your symptoms are really bad enough to get treatment. Some people tell themselves, maybe that doctor is right. Maybe it is all in my head and I'm over exaggerating. Some people have been gaslit also avoid social media, TV, films, books, and environments or conversations that remind them of past gaslighting experiences. And maybe you feel physically ill and have increased anxiety before medical appointments. And so, with all this, there's the topic of changing doctors that can frequently come up. However, it's important to know that not everyone can change doctors. It's not always possible. And there's lots of reasons for this. Institutional racism in the medical system. Maybe you live in a rural area, so there's limited choices. Maybe there's a lack of specialists in your area or that your insurance plan will or will not cover. Maybe cost, you can't afford to pay out of pocket. And of course, insurance restricts who your doctors are is a very big one. Maybe you can't travel far. And maybe you've already waited 6 months to see this doctor for a first visit. And now you're starting to read maybe not so great reviews on Google, but you can't really change. You have to see this doctor. So, going forward, kind of thinking about there's ways that you can also handle dealing with medical gaslighting if you cannot change doctors. And we're going to talk about that. So what to do? Again, if you can change doctors, great. If not, we're going to work on the assertiveness skills that you'll need to be able to approach those medical appointments. If you can, take someone with you to medical appointments. If you can, keep a record, which can be written or voice memos afterwards, of what was discussed in your appointment. And make sure to include dates and times as well. And it's also great if you're able to talk about your experience with someone you trust, such as a therapist, a family member, or a friend. A little good kind of tidbit that I've heard that is if a doctor refuses to run a test that you feel is very valid, you can ask for this to be noted in your chart. And what I found out is that many people say that when they make this request, the doctor ends up doing the test after all, especially if it is medically valid. They just maybe didn't want to or didn't think they should at that time. And also practice out loud assertive replies in front of a mirror with your therapist or with friends or family members. And so we're going to talk about some of those assertive responses now that you can practice. So before we get into that, note that assertive responses are not aggressive responses, right? If we come off as aggressive, which is very hard to do when you're feeling upset and not heard, but if we come across like that, we're not going to be heard, and the doctors and medical team will likely dismiss us even more. So here's some assertive responses you can try out to see if they fit for you and maybe make some adjustments as needed so that they feel right for something that you feel that you would definitely say. So I understand you were intending to make a joke. I did not take it as such because it felt hurtful. And a lot of people will use this one with friends or family because remember, medical gaslighting doesn't just occur in medical situations. It can occur with friends, family, loved ones, acquaintances at work, where sometimes maybe someone will say something that's hurtful. I recall one of my supervisors when I was a practicum student decided to nickname me Crash in front of all of my peers. I had just gotten into a car accident. I was a passenger in a car accident, had a neck brace on, and it was really hurtful because I was actually experiencing PTSD from the car accident. And I remember, pulling him aside and telling him how, that was hurtful. And I know you intended to make it a joke, but it felt hurtful. And I'd really appreciate it if you not, call me Crash again, right? Another assertive response is, I see that you have a different perspective than me. I'm not imagining things. Or my experience is valid. Name calling or making light of my situation is hurtful. It's hard to hear you when you speak to me like that. Another good one is, I feel like I'm not being heard, right? I know the symptoms I am experiencing are not typical for my body, and I am here reaching out for help. I feel like my symptoms are being dismissed, right? So here's some, again, responses that you can tweak to make sure that they fit you. And it's important to lean into self-compassion when you're going through medical gaslighting. And if self-compassion is difficult in that moment, and just after watching this, really acknowledge that every single person who is watching this has a personal story or knows someone who has experienced gaslighting, and try to extend loving kindness to them. Know that you're not alone, right? And if that's difficult, try to focus on slowing your breathing. Just trying to think about some assertive responses that you might say can be quite traumatic and quite stress inducing. So trying to slow your breath, and just also recognizing all of the gaslighting experiences that you have gone through can be really difficult, but also very important to healing. So every bit counts of that acknowledgement, even if it's like 5 seconds of leaning in to the experiences and emotions you're having, and then leaning out and doing something you care about in the moment. And I think above all, remembering that your voice is important and your experience absolutely matters. And with that, community matters. You're not alone. Definitely the Dysautonomia Support Network has so many lifestyle clubs and communities that you can join to make sure you get that extra support when you're feeling not heard and not understood. And that's really important when you're dealing with chronic illnesses like we deal with every day. I'd like to thank you for taking the time to just learn a little bit about medical gaslighting and some tidbits that you can start to practice for the next time you're medically gaslit. Now you can have some assertiveness responses to be prepared, right? And feel free to visit my website, Phoenix Rising with Dr. G. I have other webinars that go into details about lots of different assertiveness responses you can use. I have articles about medical gaslighting, just a lot of free resources so that you feel that the next appointment you go to, no matter what happens, you got your own back and you're your own advocate. Thank you again for listening.